previous videos, we discussed about the various aspects related to the properties of dental materials. So today we are going to start with another topic, which is the impression material. So now dentistry is a field which actually revolves around these impression materials. So an impression is actually a negative imprint of the natural teeth and the surrounding tissue. The material which is used for such an impression is called as an impression material. So this is, in short, an impression is done to record the teeth and the supporting tissue. So it will help us in replacing the tooth or doing an orthodontic treatment or giving a crown as it is in the mouth so that it facilitates its correct adaptation. So again, like any other material, impression materials can also be classified. So based on the elasticity of the material, it can be either a non-elastic impression material or an elastic impression material. Now, non-elastic impression material can be rigid material or a plastic material. Most important example of a rigid impression material is the impression plaster. Now, plastic materials are further divided into two based on its response to heat. So it can be thermoplastic, that is by using temperature or heat, I can mold these materials. So it can be an impression wax or gutta percha. Now, an impression paste, most common example is the zinc oxide eugenol paste. Now, elastic material can be hydrocolloid or elastomer. Hydrocolloid again can be one which can be used multiple types, which is reversible, that is an agar material, or one which can only be used once, that is an irreversible material, which is alginate. Now again, elastomers is further divided into polyether, polysulfide or silicon. Now silicons are divided into two types, that is condensation silicon and adhesion silicon, based on the underlying chemical setting reaction. Now, all of these materials will be discussed in the future videos. Based on the tissue displacement, impression is divided into two types. So, on that point, impression materials are also of two types. So, it can be either a mucostatic material, wherein the impression will cause minimal displacement of the tissue. So, the impression is taken with the tissue in its normal position. So, the material used is impression plaster or zinc oxide eugenol. Now is mucocompressor. Here the tissue is actually displaced. So there is lot of displacement of the tissue and the material is highly viscous. That is, it's going to be somewhat hard material that is used here. Example is impression compound. Based on the mode of setting. So it can be chemical setting or physical setting. So in chemical setting, as the name itself implies, it happens, the setting reaction happens by a chemical mediator or a chemical reaction. Important examples are alginate, which is a hydrocolloid, and elastomer. Then physical setting happens in agar and wax, which can be molded by using the temperature. Now, and any material to be used in oral cavity, it should have certain ideal properties. So now the first ideal property is that it should be non-toxic. Now it should be non-irritant in nature. Then it should have elastic property so that it allows the molding of the tissue. It should be having a good flow so that it flows into all the part of the mouth when the impression is taken. Then it should be easy to manipulate so that we can use it to patch up or capture even minute details. Then it should be dimensionally stable. That is, it should not shrink or it should not swell up after it is taken from the mouth before the cast is pulled. Then it should be cheap as well as easily available, and it should have a setting time less than 5 minutes, because if you're keeping it in the mouth for a longer time to facilitate setting, it's going to cause discomfort to the patient, so that the patient compliance will be affected. Next is that it should have good shelf life, so that it allows us to store some amount for easy usage. Again, it should have certain ideal requirements. So what are these ideal requirements? So it should be fluid, that is, it should be fluid enough so that it allows us, it just adapts to all the oral tissue and captures it properly. Again, it should be viscous enough to hold in the tray. That is, when I am loading the impression material onto the impression tray, it should not just fall out or it should not drip out. It should hold the shape of the tray. Then once it sets, it should transform to a rubbery or rigid material within a reasonable setting time, that is under 5 minutes. Then it should not have any distortion, that is, when I am removing the impression tray from the mouth, it should not tear or get distorted. Then it should be dimensionally stable, at least till the primary cast is poured, it should be stable. Then again, some materials require the material should have enough stability to allow us to pour multiple casts. If the first cast is not satisfactory, or if we need to duplicate the cast, it should have material should be rigid enough or stable enough for us to facilitate that. Again, it should be biocompatible, and like I said before, it should be cost effective. So that's all for today, guys. I just really hope that you guys understood what I discussed today. It was a very small topic, but I felt it's very important for you to understand what an impression material is before I start giving you lectures on all of these impression materials. So if you have any doubts like before, please either contact us in the comment box below, or you can directly send us a message in our Instagram page. You can address it to Dr. Lakshmi Jain and cracking.den_edu.redefine. Hope you are all safe. Stay safe, be healthy, and keep learning.